Chapter 3, Physical Development and Biological Aging. Section 1, Body Growth and Change. In this section, we're going to go over the major changes in the body through the lifespan. First of all, there are two key patterns of growth, the cephalocaudal pattern and the proximodistal pattern. Cephalocaudal refers to a growth sequence that gradually works its way from the top to the bottom of the body. For example, a baby gains the ability to hold their head up before they can push up on their arms. They learn to push up on their arms before they can learn to, turn over or sit up. And then as they gain greater control over their legs, they start to crawl, stand, and walk. The proximodistal pattern refers to a growth sequence that starts at the center of the body and moves towards the extremities. For example, babies can wave their arms and grab things with their whole fist, but it takes more time before they can control fine motor movements in their hands, such as picking up a Cheerio with 2 fingers. And as we get older, we go from wildly scribbling with crayons to being able to color inside the lines to being able to trace shapes and write letters. As individuals develop from infancy through adulthood, one of the most noticeable physical changes is that the head becomes smaller in relation to the rest of the body. At the fetal age of 2 months, the head is about half the total body length. At the fetal age of 5 months, it's about 1/3 the size. A newborn's head is about 1/4 the total body length, and the proportion continues to change into adulthood. We rapidly grow as infants, but we don't continue to grow that quickly. It gradually tapers off. Infants are approximately triple their birth weight by their first birthday. Could you imagine if we kept tripling our weight every year? But that rapid pace doesn't last. We're growing quickly, but not that quickly anymore during our preschool years. Think about the difference between a 2-year-old and a 4-year-old. And then throughout middle and late childhood, think like elementary school, we experience slow, consistent growth of about 2 to 3 inches per year. You'll notice children becoming longer and leaner, and they start to lose that baby fat that we associate with very young children. Suddenly, usually between the ages of 11 and 14, our bodies start to undergo another rapid change. You remember puberty, right? This is a period of sexual maturation, when our bodies start to make the transition from childhood to adulthood. Girls experience their first menstrual cycle, the term for which is menarche, and both boys and girls experience a growth spurt. This growth spurt tends to occur about 2 years earlier for girls than boys, so for a while you might notice that in 5th or 6th grade, girls are taller than the boys. By the end of middle school, though, the boys begin their growth spurt and begin to surpass the girls in height and weight. These changes are brought about by hormones, powerful chemical substances secreted by endocrine glands and carried by the bloodstream. The endocrine system's role in puberty involves the interaction of the hypothalamus, the pituitary glands, and the gonads. The hypothalamus is a brain structure, involved in eating and sexual behavior. The pituitary gland is like the master gland, controlling all the others. And the gonads are the sex glands, which would be the testes in males and the ovaries in females. The pituitary gland sends a signal to the testes and ovaries to start producing sperm and releasing eggs. The pituitary gland also interacts with the hypothalamus and thyroid gland, leading to growth and skeletal maturation. The main hormones that increase during puberty are testosterone and estradiol. Both are present in both girls and boys, but testosterone dominates in male development, whereas estradiol dominates in female development. Testosterone is associated with development of the genitals, increased height, and a deepening voice. Estradiol is associated with breast, uterine, and skeletal development. But interestingly, hormonal effects by themselves do not account for adolescent physiological development. There are plenty of variations in the timing and course of puberty. For example, girls are experiencing menarche earlier than in the past, and children begin puberty on average a year earlier in the US than in Europe. Factors such as nutrition, health, family stress, and other environmental factors can all affect puberty's timing. For most boys, puberty begins between 10 and 13 and a half and ends between 13 and 17. For most girls, menarche appears between 9 and 15. Almost all adolescents feel a heightened sense of self-consciousness about their bodies, which isn't surprising with so many changes going on. But when a person matures especially early or especially late, that can come with its own set of pros and cons. The two boys in this picture are exactly the same age. Early maturing boys tend to perceive themselves more positively and have more successful peer relationships than late maturing boys. It's the opposite for girls. A 10-year-old girl who looks like a teenager may experience inappropriate types of attention and pressures. Early maturation may increase a girl's vulnerability to a number of problems, such as smoking, drinking, depression, eating disorders, struggles for independence, older friends, earlier sexual intercourse, and a heightened sensitivity to stress. Once we're in our late teens and early 20s, our physical changes become more subtle. Our adolescent growth spurt has finished, so height remains rather constant. For many individuals, peak muscle tone and strength is reached in the late teens and 20s, which is why so many professional or Olympic athletes are in that age range. Peak functioning of the joints occurs in the 20s as well. During the 30s, subtle declines begin. You get tired a little more easily, you gain weight more easily, and you feel slightly stiffer in the joints. In middle adulthood, we lose a little bit of height, we gain a little bit of weight. We also experience sarcopenia, which is an age-related loss of lean muscle and strength. There's also progressive loss of bone density, especially among women, so it's important to make sure that you're getting enough calcium and doing strength-based exercises to maintain that bone density. There are noticeable signs of aging by the 40s or 50s, so by then you'll start to notice wrinkles, maybe some skin sagging, a little bit thinner hair, and maybe a few gray hairs. Cardiovascular disease increase considerably during middle adulthood. Cholesterol levels increase through the adult years, cholesterol begins to accumulate on artery walls, and blood pressure begins to rise. After about 55, the proteins in the lung tissue become less elastic, decreasing oxygen handling capacity. This is especially true for smokers. Lung capacity of smokers drops precipitously in middle age. In terms of fertility, women experience a period of transition and declining fertility throughout the 40s. Once a woman has gone an entire year without menstruating, she is considered to have officially entered menopause. As the production of estrogen declines, women tend to experience uncomfortable symptoms such as hot flashes, nausea, and fatigue. Most men, do not lose their capacity to father children, although a modest decline in sexual hormone level and activity is typical. Physical changes in late adulthood are basically a continuation of the changes seen in middle adulthood, but now the changes have become more pronounced and obvious. You get plenty of wrinkles and age spots, your weight drops because of lost muscle mass, and increased blood pressure is linked to heart attack, stroke, and kidney disease. Fortunately, various drugs, a healthy diet, and exercise can reduce the risk of cardiovascular disease, and strength training can help maintain muscle mass.